All right, so welcome. Thank you for meeting with me. I was wondering, what is your name and title, and what procedures or research do you work on?
Sure. My name is Josh Mauney, and I'm a tenured associate professor in the departments of urology and biomedical engineering at the University of California, Irvine. I'm also the inaugural holder of the Jerry D. Choate Presidential Endowed Chair in Urology Tissue Engineering. My laboratory focuses on three major areas of research, including the development of off-the-shelf silk fibroid grafts for the repair of urogenital and gastrointestinal organs, as well as the creation of preclinical animal models for medical device testing, which simulate patient pathologies, and delineation of cellular and molecular mechanisms which govern tissue regeneration at surgical implant sites.
Great, thank you. And what's important to know about these disease conditions that you work with?
Sure. So a major focus in our laboratory is the development of therapeutics and preclinical models of urethral stricture disease. A urethral stricture is defined as scarring in or around the urethra that narrows or blocks urine flow. This situation can lead to obstruction of the urinary tract, which can result in high urinary storage and voiding pressures, ultimately progressing to renal failure if no intervention is taken. This disease has a higher prevalence in men over 55 and can result from trauma such as straddle injuries, prolonged STD infections, chronic inflammation, or prior urethral reconstructive procedures. Urethral strictures are responsible for 1.5 million outpatient visits per year and are associated with various complications, including urinary stones, incontinence, and infertility in men.
Great. And what was historically done to treat this condition, urethral
Sure.
stricture?
Yeah, so surgical strategies for urethral stricture repair really fall into two main categories, and they include minimally invasive endoscopic approaches, which encompass both urethral dilation and cold knife internal urethrotomy, or open urethroplasty techniques, which include end-to-end anastomosis and substitution urethroplasty with autologous tissues or surgical grafts. So, for short strictures that are less than 1 centimeter in length, endoscopic approaches are preferred by clinicians. They're utilized to increase urethral caliber through stretching or incision of the scarred urethral area. Strictures with lengths of 1 to 2 centimeters are generally repaired with end-to-end anastomosis, wherein the damaged segment of the urethra is excised and the healthy ends are surgically reconnected. For long strictures, those that are greater than 2 centimeters in length, they require substitution urethroplasty with autologous tissue grafts in order to restore urethral continuity.
Thank you. And so what procedures do you perform, or the research that you are performing, that help solve some of these problems to advance this?
Sure. So let me just tell you first that the average length of a urethral stricture in men is approximately 5 centimeters, which means that most patients will require substitution urethroplasty with autologous tissues such as buccal mucosa for urethral reconstruction. However, the use of buccal mucosa has several drawbacks, including limited tissue volume that's available, and also the risk of donor site morbidity following extraction, which can be as high as 37%. In addition, buccal mucosa grafts resulted in a high degree of stricture recurrence when they're used to treat very long strictures that are 5 centimeters or greater in length. There's been a variety of acellular grafts that are composed of either decellularized tissues or synthetic polymers that have been investigated as alternatives with really for buccal mucosa without widespread success in clinical trials. In our laboratory, we're currently exploring the use of bilayer silk fibroid grafts for urethroplasty in preclinical models, since they possess high structural strength and elasticity, low immunogenicity, tunable biomaterial properties. We anticipate these scaffolds will serve as a superior alternative for conventional biomaterials for urethral tissue regeneration.
And what's been improved recently?
Sure. So, traditionally, prospective scaffold designs for urethral reconstruction have been vetted in non-diseased rabbit models really consisting of short, approximately 1 centimeter in length traumatic defects of the urethra. However, these settings really do not fully recapitulate the fibrotic environment of the pathology and also do not allow for implantation of scaffolds with dimensions required to reconstruct long urethral strictures. Our laboratory has recently developed novel male and female porcine models of long urethral strictures with lengths up to 6 centimeters. So right now we're in the process of investigating the performance of our silk fibroin graft technology in these systems as a stepping stone to clinical translation.
Thanks. And for those who are trying to think about some unmet needs in this field, what further improvements do you think we can make, where students can think of to make?
Sure. So I can tell you in our laboratory, we're focused on also developing sort of next generation silk fibroin grafts that will include drug delivery capabilities. And will allow them to sustain targeted release of antifibrotic compounds, as well as stem cell homing agents, which we predict will spur enhanced regenerative responses following reconstruction of pathological urethras.
Great. And is there any other final comments or things you want students to know about what they can do in the future as biomedical engineers or medical students?
Sure, I would say that urogenital reconstruction and urology in general, is sort of a field that I think would be further enhanced by having more biomedical engineers integrated into the field. And so I would encourage all of you to think about these areas in your senior design projects so we can all make advancements together.
All right. Well, thank you so much.
No problem, Dr. King. Thank you for having me. I really appreciate it.